Hello, my name is Dipak Kalra from the European Institute for Innovation Through Health Data. I'd like to tell you about how health data is driving innovation. It's an exciting topic, and I hope that you will find it interesting. First of all, though, let's look at why. Our health systems are struggling. Of course, we all know as a result of the pandemic that public budgets are tight, and so health systems have to work hard to ensure that they can deliver the best possible care most efficiently. We don't really think that it is going to be feasible to continue to invest substantially in increasing public health budgets. But at the same time, we have a challenge from the population. We are all getting older, we're living longer, and we're collecting more and more chronic diseases, and that increases the burden we place as people on our health systems. In addition, I think everybody is aware of the inequalities that exist across the geographies within countries as well as between countries. So health systems are under pressure to improve the equity of access to health systems and so on. Now, we have to do more and be smarter if we're going to rise to those challenges. But I hope you will find that health data is actually helping us to do that already, and it can do even more. So let's take a look at this massive spectrum of opportunity from health data. First of all, let's focus on the individual level, the care we need to deliver to patients. Health data and digital health can help us much more to monitor the status of people with diseases when they're at home in the community, tracking how they are, noting and responding to escalations. Of course, multiple chronic diseases means different care teams have to work together and collaborate, and that means continuity of care is critically important. We want to follow evidence-based practices, which means clinical guidelines and care pathways need to be monitored as patients travel along them, and both the patients and clinicians need real-time feedback. We need our care to be more personalized, and we need it to be more preventive, to catch diseases before they strike and certainly stop them deteriorating. And so it's really important that we deliver digital and data benefits back to the individual patient, the individual clinician, but at the level of populations, which could be regions or nations, we need to do much more also to study what's happening to our patients as they travel through illness, as they experience healthcare. How can we ensure that we improve the quality of our healthcare providers, the performance of what they do, the safety of what they do, learning as people travel along care pathways, whether we can improve care pathways. There's a huge opportunity to use medical devices and algorithms, and you've heard about AI. We are excited about that, but we need to do much more to accelerate delivery. And although at the level of individuals where you'll use AI, we need to develop AI by studying populations. Pharmacovigilance, which is drug safety. I mean, I don't need to say much about public health surveillance and strategy, because through COVID, we've seen how absolutely essential it is to know what's happening in a COVID scenario and for health systems to respond appropriately. But at the level of bigger data, which might be countries or might be at a European level, we need to study diseases, we need to develop innovative treatments, innovative devices, algorithms, sensors. So really, I hope that you can feel the opportunity is huge. We have to do more. Now, it is an exciting landscape, and during one of our projects, Digital Health Europe, we were looking at how especially in Europe, different entities and initiatives starting to scale up that data opportunity. This is a splash screen of logos, and you may not know all the logos. It doesn't matter. The most important thing is that countries at an individual country level and European initiatives, many of them funded by the European Commission, are connecting the dots of data, helping us to join up data resources so we can run big data analyses. And mostly the model of that is what's called federated architectures. That means running queries across networks of data sources so that the queries and the responses get aggregated, rather than having to build massive skyscraper databases that have huge amounts of data in them, which give a lot more data protection anxieties to the public. So that's the model we're seeing. And even more excitedly now is the announcement in the last year or so from the European Commission about something called a European health data space. That is saying, can the European Commission help us to even join these dots together and give us a bigger scale still of data? Now, we don't yet have details of how the European health data space will be constructed, but this is a concept model that we've shared with the European Commission about how we think it's going to transpire, and we hope that we've got it roughly right. So what we have in practice is a series of networks already in existence, like the Ehealth digital service infrastructure that allows patient summaries and prescriptions to travel across Europe. The regulators are putting in place the plans for a regulatory data source network called Darwin. Then there are rare disease platforms and registries already in existence connecting up data on patients with rare diseases. Then, of course, there are life sciences and national infrastructures. And all of these are forming federated networks. And we see perhaps the EHDS will be a federation of federations. But then there are players who are much more involved in kind of silos. So industry has a lot of data, clinical trials data, for example. Public health organizations and other rapid response organizations have data too, which is not yet in a federated environment, but could plug in. We see patients and citizens as being really exciting players in generating data from apps and wearables in the future, contributing to this space. And of course, the European health data space is one of a number of sectoral data spaces where there are others such as transport and the environment, which are health relevant. And so connecting to those other data spaces at a European level will enrich what we have. So we picture the European health data space as the most breathtaking opportunity yet of a bidirectional relationship, really helping to join the dots of the dots. Fascinating. But of course, we know, and we are working as a community to help the European Commission to make sure that this landscape is trusted with good governance, that data quality and interoperability are important, but also that the building blocks really enable these different networks to connect with each other in real time and deliver fast, big scale data access. Now, when we are working with the European Commission, one of the channels of working with them is called the Ehealth Stakeholder Group, and I'm privileged to be part of the Ehealth Stakeholder Group. And just in recent weeks, we've been working as a working group to look at how can the European Commission and other stakeholders help to accelerate that scaling up. And I'd like to present to you the vision that we have come up with, just really presented, as you can see from the date, very recently to the European Commission. So this is hot stuff, but it is a high-level vision I accept. Firstly, that we really see the need for citizens and patients and healthcare providers to understand the importance of the data that they are using and the data they are creating for evidence generation as well as for continuity of care. It's really important that citizens have skills and tools, if they want to use them, to assess how their data is being used and to assert their preferences for how they want their data to be used by others. We need all stakeholders, and there's a long list on this bullet, to be motivated to contribute their data into this space. We don't want people to be holding on to data, either just because they don't have the technology to connect it or because they don't perceive the importance of sharing. But likewise, in the reverse direction, we need a wide range of players to have access to this data. Many, many people can contribute to our learning if we allow them to do it, but they've got to adhere to clear, ethical and well-accepted criteria, and of course, comply with data protection regulations. Then it's important that we all use our learning to contribute to the European health data space in ways that I've mentioned. And we've also highlighted another important topic, slightly sideways, you might think, that the GDPR is interpreted and implemented in a harmonized way, because that does seem to be at the moment a bit of a barrier to this scaling up. Now, we've also developed a series of calls for actions. That's quite a few pages of detail. So I just want to highlight for you the 4 chapters of our calls to action. One is about improving the availability of robust health data. That means things like interoperability and data quality have to be handled at source. Improving data reuse conditions means making sure that the terms under which people share data, the requirements, the ethical principles are harmonized so everybody behaves well. Scaling up capability and capacity means educating everybody in how to make good, scientifically valid inferences from data, but also those architectures I've described to you. And public trust is absolutely essential without bringing the public on board. And that means giving them convincing and trustworthy evidence of how we are behaving ethically. Without that, we won't succeed at all. And that's something that our institute is very keen on. We work across stakeholders to help us all to collaborate and co-create the solutions that we need to capture and share better quality data, and also to use that data in trustworthy ways. Smarter healthcare and efficient research, that's what we all want. And I hope you feel motivated to roll up your sleeves and be part of that game. Help us all to have great healthcare in the future. Thank you very much.